Ahmedabad-based a doctor couple there, tested positive for Covid-19. In fact, the duo had completed both the vaccination doses as healthcare workers, but despite that, it seems like they've caught the virus. Now, a doctor in Solan, Himachal Pradesh, has tested positive of Covid-19 27 days after taking the second vaccine dose. And then you have doctor samples that were being sent to a Mumbai-based lab as well to ascertain the cause and to also rule out the presence of any mutant strain. And on the other hand, we're looking at an MBBS student in Mumbai who tested positive days after getting inoculated by the second dose of the Covishield vaccine. You also have a 71-year-old doctor working in a government hospital of Rourkela, Odisha, who've tested positive 3 weeks after receiving the vaccine dose here, the second dose of the vaccine. In fact, a retest, however, found him negative of the virus. So we're looking at several complications in terms of a few of those frontline workers who've got the jab contracting the virus post the second dose of the vaccine. Of course, investigation into that is still underway. Now, coronavirus cases continues to rise in Maharashtra. The state reported 15,051 cases on Monday. This is the fourth consecutive day that Maharashtra has reported more than 15,000 cases. The Union Health Secretary has written to the Maharashtra Chief Secretary of calling for strengthening of containment strategies. The letter also states that measures such as night curfews and lockdowns have very limited impact on containing transmission. This comes after the Uddhav Thackeray government on Monday issued fresh COVID guidelines. As per the new norms here, hotels, restaurants and theatres will operate at 50% capacity. There is no permission for political, social and religious gatherings. Only 50 people will be allowed to attend weddings and 20 people can attend funerals. Any violation here will attract heavy penalties.
मुंबईमध्ये लॉकडाऊनची शक्यता आम्ही कुठेही म्हटलेलो नाही. त्याचं कारण असं आहे की मुंबईमध्ये लॉकडाऊन कधी करावा याचे काही निकष आहेत. पण हे नक्कीच आहे की मुंबईमध्ये महानगरपालिकेमध्ये 20 लाख लोकांना फाईन केलं मास्क नाही या कारणाने आणि 42 कोटी रुपये यामधून जमा झालेले आहेत.
Coronavirus cases in Mumbai are continuously on rise. We are in right now Dadar market area and here you can see how the social distancing norms are not being followed. Now, this is one of the most important markets of Mumbai. From here, vegetables and fruits are supplied to whole of Mumbai. So there will be a lot of crowd over here. But if you can see, the social distancing norms, that is not been followed. Second is people are not wearing masks. Even if there are people wearing masks, they are not wearing it properly. Now, there are BMC marshals who actually come over here, they find people. But even then, that is completely not possible to find all of them. Therefore, people actually have to follow all the guidelines which are issued by the government, because right now in Mumbai 1500 to 2000 is the average, that is the daily number of cases which Mumbai is getting every day, which is a matter of concern for all. With camera person Samir Shanbag, this is Farah Bhaktania in Mumbai for India Today.
Now, let's quickly cut across to all those curbs that the Maharashtra government has now put in place owing to the spiraling cases of Covid-19. Theatres, hotels, restaurants, we're looking at only 50% capacity henceforth owing to the cases now, case rise. Masks that are now made compulsory. It was always compulsory. It's now strictly implemented. We're looking at strict temperature monitoring at every entry point. Hand sanitizers, a must. Again, like I said, these are precautions that are already taken in place. It's going to be strictly implemented. Any violation will attract penal action. We're looking at several officers to enforce social distancing rules there strictly in place. If they are found, anyone found there flouting those rules, they will be cracked down on. Public gatherings, ban on social, political, religious gatherings there. If at all violated, property of and that premises will be shut immediately. 50 allowed at weddings only, and 20 people allowed at funerals alone. Here are a series of guidelines that have been put in place in Maharashtra, and it appears the government is now strictly looking at penalizing those flouting those rules. Let me quickly cut across. All right. We're looking at some controversies arising. The vaccine AstraZeneca. 3 countries suspend AstraZeneca COVID vaccine amid serious side effects. In fact, the 3 largest EU countries, Germany, Italy and France, all paused rollouts on Monday and were later joined by Spain, Portugal, Slovenia and Latvia. There have been a number of cases in Europe owing to blood clots developing after the vaccine was administered. In fact, the World Health Organization, though, has now urged countries not to pause COVID vaccinations and urged people not to panic. It said that there was no evidence of a link between the vaccine and blood clots. The Indian version of the Oxford AstraZeneca COVID-19 vaccine is known as Covishield. Following the suspension here of the vaccine by several countries, the central government has now decided to conduct a deeper review of post-vaccination side effects from the Oxford AstraZeneca COVID-19 vaccine. In fact, as the world's largest COVID-19 vaccination drive is currently underway in India now, India has nearly administered 3 crore cumulative vaccination doses. We're looking at the government now looking into post-vaccination side effects of the Covishield, AstraZeneca Covishield in India currently.
Several more countries have suspended the use of AstraZeneca vaccines as a precautionary measure after reports of blood clots in people who had received the vaccine from 2 batches produced in Europe. This does not necessarily mean these events are linked to vaccination, but it's routine practice to investigate them. And it shows that the surveillance system works and that effective controls are in place.
Now, I did speak with experts on this new development on AstraZeneca and the side effects that it's reported and how would it impact the vaccination drive in India. How are we going to avoid further vaccination hesitancy? Let's take a listen. Was it really so serious for many of the European Union nations to take an instant decision to ban the AstraZeneca for now?
So there are reports of deep vein thrombosis in the lower limbs, and we are talking about the veins, the big veins which are draining the lower limbs. They have found the clots in that particular area, and from those clots there are some small embolus. It goes to the lung and causes pulmonary embolism, which is a life-threatening condition. So both are interlinked to each other. So there are a few cases, but as my first panelist has told, that these numbers are lower than what happens in a normal population. So definitely these are happening and it's a serious event, but we cannot say that these events are because of vaccine or they are just happening because of the other causes. So definitely we have to look into all these side effects more carefully, and we have to establish a cause and effect relationship between these two, which is very difficult to establish right now. We have to establish the risk-benefit ratio of vaccination, and which I can say right now the risks are very low and benefits are too high, and that's why our government has decided to continue the vaccination, because out of 3 crores we could not find even a significant number of these kind of side effects. So I think this is what we should right now decide, that we have to go on with the vaccination. And I want to tell, even I have got my family vaccinated with the Covishield only. My many friends have got Covishield and none of them had any kind of side effects.
What's ironic, in quite a few cases, in fact, India Today itself has reported on a number of cases where the frontline workers, doctors, have contracted the virus yet again, despite being given 2 doses. So this is another unique complication that's now risen, while Dr. Anup says that the benefits of the vaccine are far greater than its side effects at all, and side effects are far fewer. Here we're looking at some of the cases where people are contracting the virus yet again. What do you think is the reason for that?
So can I talk now?
Go on, Dr. Prathap, we can hear you.
See, one important point you should understand, that there are reports of cases only less than 300 adverse effects reported in 3 crores of population, means it is a very, very minimal side effect as reported. And this is actually in contradiction to what we think about. That disease actually creates a lot of death all over the world. And as such, you should understand that this vaccine did not create a real major problem, which all people anticipating, number one. Number two, as a cardiologist, I have seen 1 or 2 cases, actually, even after stenting, without our knowledge, the patient gone for an angioplasty and the patient came back. Even after I was guided, stent apposition was perfectly documented by us. The third day is a physician in that our place. he came back to me just after COVID vaccine. He had a stent thrombosis, which we documented by OCT that was not due to definitely not to the stent problem. It is basically probably because of the thrombosis, the vaccine, which actually I did not exaggerate that point, because when we talk about the vaccine issues to the crowd, what we are actually going to anticipate, it's a major problem to the national people, actually the normal persons, and telling that this is actually going to create a lot of problem. I personally feel that the vaccine really created a major impact in preventing a major disease and its complication definitely to a great extent. So we should not create a panic on these things rather than motivate the people.
Now, I'm going to take you through all those countries that have now temporarily suspended the AstraZeneca vaccine. We're looking at France, that's now decided to suspend the vaccine. Italy has decided. Germany has now decided to suspend and pause this vaccine here. Denmark, Spain, Portugal, Austria, Estonia, Norway, and Iceland. We're looking at these countries that have now decided to temporarily ban AstraZeneca vaccine until further investigation owing to blood clots that have been reported after the vaccine administration. Now, moving on, Prime Minister Modi has called for a virtual meet with state chief ministers tomorrow after India reported its biggest COVID spike of the year. Just yesterday, India recorded as many as 26,291 fresh cases, taking its active caseload to over 2,19,000. Now, the spike is largely fueled by rising COVID-19 cases in 8 states, including Maharashtra, Punjab, Karnataka. Maharashtra, in fact, which remains the worst hit state, accounted for over 62% of Monday's new cases, also registering its highest single-day spike of the year at 16,620 new cases. In fact, Punjab government, on the other hand, has postponed the board exams by a month. The state reported 634 new cases, taking its total tally of active cases over 11,500. In view of a grim situation, Madhya Pradesh now, the Madhya Pradesh Assembly will decide on adjourning the House in an all-party meet today. This comes after 4 sitting MLAs, 5 marshals and 3 admin staff members of the State Assembly tested positive. In the South, B.S. Yediyurappa government has now decided to increase testing and contact tracing. It also, in fact, it has also made RT-PCR test reports compulsory for travellers arriving from Maharashtra and Kerala. Here we're looking at rising cases, and many of the state governments have taken disciplinary action only to ensure the crackdown of the spread in the virus. We're looking at several states all the way from the north to the south implementing new norms and curbs only to ensure that coronavirus infection spread is halted. Now, I'm going to quickly cut across to the kind of measures that's been taken in by the Maharashtra government. In fact, Maharashtra, Nagpur has announced a lockdown until the 21st of March, a complete lockdown. Only essential services will be allowed in Nagpur. Government offices now to function with only 25% staff in Pune. Now, in Nagpur that was. In Pune now we're looking at night curfew from 11 p.m. to 6 a.m. Schools, colleges shut until the 31st of March. All public gatherings there remain closed in evening. In fact, those gardens there will be shut. Akola, we're looking at weekend lockdown only. In fact, night curfew in Latur to be implemented from 8 p.m. to 5 a.m. We're also looking at Punjab now. Class 12 board exams postponed until 20th of April. And Class 10 board exams postponed to May 4th. Madhya Pradesh, we're looking at all-party meet to curtail assembly session there. Of course, 4 MLAs of the 5 assembly marshals, 3 staff have tested positive of COVID-19. Karnataka also, we're looking at increased contact tracing and testing in the state. We're looking at RT-PCR tests now, a must, a mandatory for crossing state borders, especially those coming in from Maharashtra and Kerala into Karnataka will have to have an RT-PCR negative report. So these are the measures that have been taken by respective state governments. On that note, we continue tracking these updates. We're slipping into a short break. We'll be right back. Do stay tuned.